All right, we're going to go ahead and get started here. I would like to welcome everyone to today's FAST-TRAK training lab. Today's session is brought to you by DocShop Pro. DocShop Pro is an inventory management and supplies platform for private practice podiatrists. My name is Tony, and I'm the TRAKnet client trainer. And joining me today is Erica, who's one of our customer care representatives. In this webinar, we'll be covering questions you as our clients when using TRAKnet and the program. All users will be in listen-only mode, and please post all questions to the questions box on the webinar menu. I do want to remind everyone we do want to check to make sure that we are all up to date. The current TRAKnet version is currently on the screen. And then I will also go over how to check that here. So for checking for updates, we're going to go to the top, click Help, and click Check for Application Updates, and that'll check for any available updates for TRAKnet. All right, and then Erica, if you can go ahead and please start us off with our first question.
Absolutely. The first question here is how to add patient education links to the CCDA.
All right, that's a very good question. The patient education links are automatically added to the CCDAs when you load the CCDA template. So when we go down to our patient engagement, we select our template. The patient education links for that patient are automatically added to that template. You also have the option of doing just the patient medication links themselves by clicking that Medline Plus links. And then if you wanted to do additional patient education materials, you would have to set up a patient education template and then drop that template in, similar to how you would do on an encounter. You would select the template on the right-hand side and it's going to drop that template in for you. When you send the CCDAs by the CCDA button at the top, it automatically loads your default CCDA along with those patient education links and sends them over.
Okay, perfect. The next question is there a way to run an audit by patient that will tell you who entered information into the chart?
All right. Yep, there's a way to run an audit by patient. It's going to be under Tools, Audit Log. And there's three options for the audit log. There's logins, which will tell you who logged in and when they logged in. There's patient, and that's going to be the one you're looking for that tells you what was accessed on the patient, if an encounter was changed, if demographics were changed, all that information is going to show up on that patient audit log. And there's also an audit log specifically for prescriptions and refills as well. So those audit logs are going to give you that information of who did what.
Okay, thank you. The next one here is when in the appointment list in the patient's chart, is there a way to modify the verbiage, dates of appointment?
Yeah, I do apologize. The appointments is a read-only section. You're only able to view what appointments are there. You wouldn't be able to edit any of the information from that view.
Okay, thank you, Tony. The next question came in a couple of times. It's in regards to a patient refund, how to do those.
Okay, with the refunds, it's going to depend on what type of payment it is. If the payment is a credit card payment and you're integrated with TRAKnet, and you're looking to refund the full payment, you would simply go to the ledger, to payments, select the payment, and remove it. What that's going to do is that's going to remove that payment from TRAKnet, and it's going to send over to Transfers to tell them this payment needs to be refunded. And then depending on the status, it'll either refund the payment back to the patient or void the payment transaction, so it would stop the transaction from going through if it hasn't gone through already. The second method is if you're going to be doing a partial refund. A partial refund is going to be done through a provider payment. And when you're doing a provider payment for a refund, you're going to want to make sure that you have the refund option for your payment types. You're going to need to come over to Properties, to Payment Types, and look to see if you have that. Here in my system, I have a refund listed for providers. So when I go to my patient and I go to payments and I do a provider payment, I would select the charges. Generally with a refund, you'd want to make sure that you've applied the charges, the payment to a charge so that it leaves a positive balance. In this case, I don't have any positive balances, so we're just going to do a refund on one of our lines that we have a payment on. We select the line, and we do a refund for the amount that we want to have. So we're refunding $10 on this. We add that in, and it does $10 refund for that patient. Click Commit Adjustments, select the type of refund, and click Save, and that does that partial refund for that payment.
All right, thank you. The next question here is how can the time date stamp be removed from the progress note when signing and closing? Can the time be removed from vitals?
All right, yeah, I do apologize. We cannot remove the date time stamps from signing the notes. That is put in there to indicate when the provider signed that note. That cannot be removed from there. And then that goes the same with the vitals link. When the link pulls that information in, it pulls that in so it can indicate when those vitals were completed. There's no way to stop it from pulling in the time information for the vitals. So with those, they have the dates. They're not able to be removed.
All right, thank you. Does TRAKnet have the capability for providers or facilities to electronically transmit to our software? Example, referrals from another provider.
TRAKnet does have the capability to receive direct emails. So a referring provider can send you a referral letter pretty similar to how you would send out a referral letter to another provider. They'll need to have your direct email address and participate in a direct email service themselves as well. So your direct email address is going to be on your inbox tab, and your direct email is going to be down on the bottom here. It's generally your practice ID, and then the word TRAKnet and your practice ID at directemr.com. You would provide that to them. They can send a message over to you, and then you'll see it similar to what it is right here when they send in the message to you. It'll depend on how their direct mail system works as to whether or not you receive it as a message or as in this case where mine is received as files.
Okay, Tony, when putting in the patient's medical and surgical history, why do you have to update the list each time to see all the choices?
Okay, well, I do apologize that that is occurring. Unfortunately, with some systems, we're not getting the entire list showing up. We're not getting where the scroll bar can scroll. That has been identified as a bug in development, working on determining what's causing that to happen when we are planning on getting that fixed on the next update. So development's working on figuring out what's causing that bug to happen. So for the time being, the updating the list is the workaround for that bug.
Okay, is there a way to delete messages from the inbox?
No, there is not a way to delete messages from the inbox. The inbox keeps all messages so that we have that information to keep track of what's going in and out. There's not a way to delete them.
Okay, which Dragon dictation should I use? Is the next question.
All right, we've tested Dragon 13, natural speaking, and that works the best with our software. So that's going to be the Dragon option you'll want to go with when using it with TRAKnet. And as again, the Dragon 13 natural speaking software.
Thank you. Can I see everyone's task in the task list?
Users with the permission to see all tasks can see everyone's tasks under the All Tasks group. This is a permission set under users, so you can block people from being able to see all tasks by going to the user going to the permissions and removing that view all tasks.
All right, thank you. The next question that came in here, does TRAKnet have the capability to do e-fax or fax receive or send directly from TRAKnet?
And TRAKnet does not have the capability to fax or receive faxes. So we're not, if you are going to have a fax to place in the software, you would have to scan that into the patient's multimedia. There's not a way to bring a fax electronically into TRAKnet. And then it's the same going out. There's not a way to fax out from TRAKnet.
All right, thank you. The next question is regarding meaningful use, objective 8. How is the denominator counted? We have very few patients with emails.
Okay, for meaningful use objective 8A, the denominator is counted by any patient who has a visit. So any patient that the doctor sees in the office counts as a denominator. The timely access is that the encounter is signed and closed and a summary is sent to that patient within 4 days. So the denominator counts anyone who's been seen, and the numerator is going to count anyone who's had a summary sent to them of a completed note within 4 days. And that is within the reporting period. So only patients that are seen within that reporting period count towards that denominator.
Thank you, Tony. How do I submit PQRS to MedExpress and other registries?
Okay. PQRS submission to MedExpress or other registries is done still using the PQRS report. If you're doing measures that are not in our PQRS report, you may have to pull several reports to get the information they want. But if you're doing the measures within our report, you'd want to come to the report, make sure to select the report type of registry and your time frame, run your report, and then click the export button here. That's going to export the CSV file to where you save it to. And the CSV file is going to contain all the patient data that the registries need to have for your reporting. Like I said, if it is not one in this report, you would have to use the reports screen, the billing dashboard reports, and pull the individual data and make that CSV file manually from those reports.
Okay, thank you. And how do I create a new encounter template?
All right, well, there's 2 ways to create a new encounter template. The first way would be creating a new blank encounter template. And for that, we simply go to Encounter Forms, give it a name, and then if desired, a folder. And then we can place whatever we want to have in here. We could make it a SOAP note. We can make it very specific to a condition using the templates and the patient data and text fields and free type in there. Then once we click Save as New, that creates that new template. We can also create a new template by going to the Encounter Forms, selecting a template that's close to what we want to have. So maybe we want to have something pretty close to an abscess. Give it a different name. And then click Save as New. And that's going to create that new template, and we can make any changes to that new template that we want to have and save it to that new template by clicking the Update button.
Thank you. The next question that's coming in here, how do you respond to an email received from a patient?
There is not a way to directly respond to an email received from a patient through the direct email. You could potentially send another notice out through the patient engagement, which would go over to their Health Vault account, or send an email to their regular email address if it's doesn't have anything that requires secured email. But there's not a way to directly respond to a direct email coming into TRAKnet.
Thank you, Tony. How does one use Dragon Naturally Speaking with TRAKnet?
I certainly do apologize. I have never used Dragon before, so I'm not familiar with the Dragon interface. That would be something where I would imagine it would work the same as it does with other programs. But for that, I would have to say you'd want to refer to the Dragon training websites as far as how Dragon functions with other programs. Now, the Dragon 13 Naturally Speaking has shown to work the best with TRAKnet out of the rest of them, but and like I said, I certainly do apologize. I've never used Dragon myself, so I couldn't say how to actually use it with the program.
All right, thank you. How can I merge patient information into TRAKnet from the patient portal?
All right. For bringing in patient information from the TRAKnet patient portal, once you've received a request from a patient and you've authorized them to set up a patient account and they've entered their information in, they have a send info button. Once that's been clicked, your patient portal up here is going to highlight red, like mine is now, and we're going to see a new connection here. Anytime they send information over, a patient sends information over, we're going to have that new connection show up, and we can click on that, and that's going to bring up our new connections window. This is going to tell us what our new connection is, and it's going to look for a patient that meets that information. So with this, we can merge our patient if this is the patient in the system. If it's a new patient, if it's someone we haven't seen, we can do add new patient. I'm going to do the merge patient because this is a patient that's in my database. This is going to tell us what information is in our database and then what information the patient entered in. And as you can see here, we have several sections that are red. If the information on the right-hand side is different than the information on the left-hand side, the right-hand side is going to be red, and you'll have the option to update that information. You can do it one by one. Or if you have a situation where there's a misspelling and you don't want it to update, you can not update the specific lines. And then if everything is okay and you want to update everything, you can update all. If they have additional insurance information or medication information, you're going to receive additional tabs up at the top to also do the insurance and medications and all that information as well. Once you've updated it, you can click Complete and Clear, and that'll remove that from your list, and it'll update the patient in your system with the new information. So if we go to our patient here, we can see it now has our new information.
Okay, thank you, Tony. The next question is, how do I embed a treatment code on an encounter template?
Okay, yeah, that's definitely an excellent question. Embedding treatment codes on templates that helps with speeding up with the billing. So when we're doing it, embedding a treatment code, what we're going to use is our straight brackets. So if we wanted to embed an office code, we know every time we use this template, we're going to charge this office code. We put the straight brackets in there. Those are the ones right next to the P and right above the Enter key. And once we click Update, TRAKnet knows that that is an embedded code, and it embeds that code in it. And that can be done on any template. So you can use that on your mini templates. I know I've worked with a doctor who likes to take his plan templates and places treatment codes in all his plan templates. So when he's going and putting in his plan, it just automatically puts his treatment in for him. So that can be done on any template, and it'll pull in when that template's pulled in.
All right, next. How can I add links to my dashboard?
Okay, adding links to your dashboard is done using the Edit button on the dashboard. It's going to be the easiest way to do that because it's going to bring you right up to that dashboard. And then it works the same way as with an encounter template. You can add in, just drop the links in. So if you just wanted to drop a link in, you can do that. I definitely recommend keeping them uniform. So what I like to do is I like to copy the table that's currently there and drop a copy of that table in, and then remove my header and everything, add that all in so I have that uniformity on my dashboard template.
Okay, perfect. The next question that came in here, how can we unbundle insurances when posting? Example, there are different United Healthcare addresses, but the insurance is listed into only one location for billing purposes.
Okay, I'm not sure I fully understand the question. When posting payments, the payments are posted based on the payer ID that Gateway sends to us, and they're posted to this patient specific to that payer ID. So there's not any way to really, if like in your case, United Healthcare has multiple different addresses, there's not any real way to separate them on that check. They're all going to come in on the check that comes in, and they're going to be posted to the appropriate patients according to their payer ID and the claim history from the patient. So there's not really a way to separate them out of that check.
Okay, thank you. The next question here is, how do I post a write-off?
Okay. A write-off is going to be done the same way as a refund. It's going to be done through a provider payment. Now, when doing write-offs, one thing to keep in mind is that on an insurance payment, there's a quicker way to post those provider write-offs. So I'm going to bring up an insurance payment here real quick and show that. When doing write-offs for an insurance, if you're going to be doing several write-offs for a check, you can come over to your provider adjustments section, and it's going to show you the items that you may want to write off here, and you can do several of them at a time here. And this is just like doing a regular provider payment. It's just doing it in this check to kind of save you some time so you don't have to go back out, look up each individual patient, or do a separate provider payment. You can do it right from the insurance check. And you select the ones you want to have and click Commit Adjustments. Outside of the check, you're going to do a provider payment. Search your patients that you want to have the write-off for. Add in the amount that you're writing off. And then click the Commit Adjustments and select the payment type write-off. If you don't have the payment type write-off in your system, you would want to go over to Properties, go to Payment Types, and add that payment type in there. Click Save, and that saves it to your system.
Okay. I need to switch a claim back to ICD-9, but the diagnoses are blank when I do. Why?
Okay. There are two ways to enter diagnosis codes into a claim. There is using the Smart Sheet, which is going to add an ICD-9 and ICD-10 code. As you can see here, we have both codes. And then there's using the ICD-10 search. If we add in a code using the ICD-10 search, we only get that ICD-10 code added. Whereas if we add a code in using the Smart Sheet, we get both codes. If the encounter was created using only the ICD-10 codes, when we switch to ICD-9, there is no ICD-9 code for it to pull. So in that instance where you're having blank ICD-9 codes, you'd want to come over to the Diagnosis tab, remove the ICD-10 codes that are by themselves, and place in the smart sheet code that has the ICD-9 and ICD-10, and that'll allow you to switch back and forth between ICD-9 and ICD-10 and still have those codes.
Okay. How do I correct the location on a claim?
Okay. The location can be corrected right from the visit note. Let me see if I can find a signed one here. All right. So even after the note's been signed, the location field stays available so that it can be changed. So if you need to change the location for billing, you can come right over here and change the location where it's being billed to. That's going to change it on your invoice, and then when you send that back out, it'll be changed for the claim.
Okay. Can we print out the patient CCDAs and have that count towards meaningful use?
No. Meaningful Use no longer has providing a paper copy of the CCDAs. The CCDAs must be sent electronically to count towards meaningful use. There's no longer a providing them a paper copy.
Okay. Thank you. And how many registries do we have to sign up for?
We need to sign up for 2 registries. For podiatrists, that generally means 2 special registries because ambulatory syndromic surveillance data is not collected, and usually in most cases podiatrists aren't doing immunizations, so that generally means 2 specialized registries. To my understanding, a registry company like MedExpress can set you up with the 2 registries, so you only have to work with one company, but you're able to post to both registries through that company.
Okay, we have some room for a couple of more here. When creating my notes, I noticed that the cursor doesn't click to the next cursor spot as it did in 3.0. Can this be done in TRAKnet 3.0 so that I don't have to click on each individual area? This sounds like the tab feature.
Yeah, it definitely does. When creating a note, and we'll go with a new note because my testing ones are not very good for that feature. When creating a note, 3.0 has a feature called tab blanks. When you're ahead of a field, if you hit the tab button, that's going to bring up what you want to answer. And then once you've hit that tab button, it's going to keep bringing up each one of those fields until you click cancel, which causes it to stop. Then to start it back up, you just select another spot in the note, click the tab again, and it'll start back up and keep going until you click cancel or you run out of things to answer.
Okay. Thank you, Tony. Is the influenza and pneumonia still necessary in PQRS?
The influenza and pneumonia requirements are items that we brought in as suggestions of ones to be completed because they're fairly easy and generally relevant to the practices. These items on this list are in no way required. You can definitely go through the different PQRS items that CMS has. These are just the ones that we recommend, so they're not a requirement that you use the ones we recommend. It's just the ones we recommend, and it makes it a little bit easier because we did place them in a report in TRAKnet so that you can pull them more easily. All right. Looks like that is about all we have time for. I want to express to you guys we do have several resource pages. Our YouTube page has a number of different videos, and then our wiki page also covers every area of TRAKnet. Our client success team will reach out to those whose questions were not answered after the webinar. And then please join us again in 2 weeks for another Fast Track training lab. And everyone have a wonderful afternoon.